NCS Part 5 Segmental Stimulation in Short Increments, also called inching technique. The inching technique is a specialized nerve conduction study used to detect and precisely localize focal demyelinating lesions in the entrapment neuropathies. In routine NCS, conduction velocity is measured over relatively long nerve segments. When a very small diseased segment is included within a long normal segment, the slowing effect becomes diluted, reducing the sensitivity of the test. Principle: inching involves stimulating the nerve at very short intervals, usually 1 centimeter apart, along its course and recording the latency change between successive points. Because each segment is short, even a tiny conduction delay becomes obvious. Normally, conduction time 0.2 millisecond per centimeter, velocity 50 meters per second. If demyelination affects 1 centimeter segment, latency may increase from 0.2 milliseconds to 0.4 millisecond per centimeter. This becomes a 100% increase over a short segment. However, if the same abnormal segment is included within a longer 10 centimeter study, normal total latency will be 2 milliseconds. Increase becomes only 0.2 milliseconds. This represents only about 10% change, which may still fall within normal variability. So, short segment stimulation generally improves detection of focal slowing. Why inching is more sensitive? Technique provides better spatial resolution, precise localization of focal compression, identification of very short demyelinating segment, detection of lesions missed on routine NCS. Clinical uses: the inching technique is especially useful in carpal tunnel syndrome, ulnar neuropathy. Examples in carpal tunnel syndrome. During median nerve inching across the wrist, normal latency change is 0.16 to 0.21 milliseconds per centimeter. A sudden increase in latency over a single 1 centimeter segment indicates focal compression within the carpal tunnel. An abrupt change in waveform, amplitude, or latency often occurs exactly at the compression site. Key exam points: inching is actually centimeter by centimeter stimulation. Best for detecting focal demyelination. Improves sensitivity compared with routine long segment conduction studies. Commonly used in median nerve and ulnar nerve entrapment neuropathy. The main advantage comes from the fact that small focal delays become proportionally much larger when measured over very short nerve segments. This is why short segment stimulation is considered a high resolution localizing technique in electrodiagnostic medicine. Here we can see 12 sites of stimulation in 1 centimeter increment along the length of median nerve. The zero level is at the distal crease of the wrist, corresponding to origin of transverse carpal ligament. SNAP and CMAP are recorded from the second digit and abductor pollicis brevis respectively. Second image: SNAP in a normal subject recorded after stimulation of median nerve at multiple points across the wrist. The site of each stimulus is indicated on the left. The latency changes increase linearly, approximately 0.16 to 0.21 milliseconds, as the stimulus site was moved proximally in 1 centimeter increment. What happens in carpal tunnel syndrome? In carpal tunnel syndrome, there is focal demyelination or compression beneath the transverse carpal ligament. Instead of smooth latency progression, there is a sudden jump in latency, waveform distortion, possible amplitude reduction. This abrupt change localizes the exact compression segment. Important points. It is also called segmental stimulation, short segment conduction study, centimetering technique. Best used for carpal tunnel syndrome, ulnar neuropathy. Advantage: precise localization of focal demyelination, diagnostic clue, sudden latency increase across a single 1 centimeter segment. Most useful when routine NCS appears normal but clinical suspicion remains high.